Try this. Put 2 fingers right here on the side of your neck. Press in. Does it feel like a rock? That's why you can't sleep. In my 12 years treating patients with chronic sleep problems, the thing that shocks people most is that the fix wasn't a pill. It wasn't melatonin. It wasn't a better mattress. It was their neck. I'm Dr. Marcus, a neuromuscular specialist, and what I'm about to tell you is going to change how you think about sleep forever. Here's what nobody tells you. Your brain doesn't just decide to fall asleep. It has to receive a signal from your nervous system to shift from alert mode into rest mode. That signal travels through your vagus nerve, which runs directly through your neck, right alongside a muscle called the SCM. Your SCM, sternocleidomastoid, is that thick cable on the side of your neck. It's the most overworked muscle in your body. Every time you look at your phone, sit at a desk, drive your car, or even stress out, this muscle tightens. And when it's tight, it compresses the vagus nerve. The vagus nerve is the master switch between your fight or flight mode and your rest and digest mode. When it's compressed, your body stays locked in a low-grade state of alert. Your heart rate stays elevated, your mind keeps racing, your body physically cannot downshift into deep sleep. That's why you lie in bed exhausted but wired. That's why your brain won't shut off. That's why you fall asleep but wake up at 2 a.m. or 3 a.m. and can't get back down. Your body is tired, but your nervous system is stuck in the on position because your neck won't let it switch off. And here's what makes it worse. When you don't sleep well, your muscles tighten further. Your SCM gets harder. The compression gets worse. So the next night is even harder. You're trapped in a cycle where bad sleep causes more neck tension, and more neck tension causes worse sleep. This is why melatonin doesn't work for most people. Melatonin is a chemical signal telling your brain it's time to sleep. But if the nerve pathway is physically compressed, the signal can't get through. It's like turning up the volume on a speaker that's unplugged. You don't have a chemical problem, you have a mechanical one. I used to spend 45 minutes per session manually releasing the SCM on my patients. Deep tissue, targeted pressure, grip and release, working the tension out fiber by fiber. And almost every single one of them would say the same thing the next morning. That was the best sleep I've had in years. Not because I gave them anything, because I removed the thing that was blocking their sleep. The problem is, most people can't come see me 3 times a week. It is the first mechanical tool that replicates the exact grip and release technique I use in the clinic on the SCM. It doesn't just vibrate. Vibration doesn't release deep muscular compression. This physically grips the muscle, kneads it, and decompresses it. Combined with 42-degree heat that dilates the surrounding blood vessels and softens the tissue. 10 minutes before bed. That's the protocol. You lay down, put it on, and let it systematically release the tension that's been keeping your nervous system locked in the on position. What happens next is something my patients describe the same way every time. They say it feels like their brain finally goes quiet. The mental chatter slows down. Their body feels heavy in a good way, and they fall asleep without trying. I had a patient, Lisa, 42, marketing executive. She hadn't slept through the night in 3 years. She tried everything: melatonin, magnesium, CBD, weighted blankets, sleep apps, mouth tape, even prescription sleep medication. Nothing worked for more than a few nights. I examined her neck. Her SCMs were like steel cables. I released them manually, and she came back the next week and said she slept 7 hours straight for the first time in years, and told her to use it every night. 3 weeks later, she told me she'd stopped taking all her sleep supplements. She didn't need them. The blockage was gone, and her body was doing what it was designed to do. Here's what most people don't expect. When you start sleeping deeply again, you also wake up looking completely different. The same muscle that blocks your sleep signal also blocks fluid drainage from your face. So when you release it, 2 things happen. You sleep through the night, and you wake up with a visibly leaner, less puffy face. My patients call it the 2-for-1. Better sleep, better face. Same 10 minutes. I want you to try something. Tonight before bed, press into the side of your neck. Find that thick, ropey muscle. If it's tender, if it's hard, if it feels like it's made of concrete, that's your problem. That tension is the reason your brain won't turn off at night. Use HiZora for 1 week, 10 minutes before bed every night. If you don't sleep deeper than you have in years, if you don't wake up feeling like a different person, send it back. It does the same thing as a year of manual therapy for the price of a single session. You don't have insomnia. You have a neck that won't let you rest. Release the neck, sleep through the night. Get your sleep back.